Hi everyone, Elizabeth here at VSoft Lift. Today we are doing a treatment with lifting threads. We are going to be doing a nasolabial fold, marionette, jowl, and jawline thread. So pretty much she is getting a full lift. She has had threads previously and she is one of the patients that loves them. She comes back and gets maintenance threads once a year and she has gotten really good results over time. And now we're really just maintaining. So here I am just kind of pinching and pulling and looking at where the tissue is the heaviest. As you can see, she's laughing. We're kind of just consulting as we're going along. She, like I said, has been getting treatment for a while. She has achieved good results. So really we're just doing a little bit of tweaking. So I'm really pulling and pushing that tissue. We're going to be doing a few in the neck as well. These are her favorite. This is just going to help over time lift that medial tissue and help prevent, a quote unquote turkey neck. So now we are going in and placing our lidocaine. And for some reason, I did think we did a full face, but we're actually just tweaking her nasolabial fold, jawline, and neck. But here I am going in with my lidocaine with epi, and this is an 18 gauge needle. This is just for my pilot hole, so I'm able to easily get my cannula into the correct plane. And now I'm coming in with a 22 gauge, 75 millimeter cannula. And this is to pre-tunnel. So this isn't necessary. This is really provider preference. I choose to pre-tunnel because I am typically coming in with a much larger gauge thread. So it just makes it a little bit easier to navigate through that tissue. Because I'm going through and pre-tunneling already, I do use this to go ahead and numb at the same time. But again, this is provider preference. If you would just like to put your lidocaine at your insertion point and at the ends, you can do that as well. There's really no right or wrong way as long as your patient is comfortable. But like I said, I prefer to pre-tunnel because now I'm coming in with an 18 gauge thread and it's a much bigger gauge. So I like to have that little pathway already kind of planned out for myself. So now I'm just going in with my thread and I'm using my left hand as my smart hand to just gently pat and touch and make sure that I am in a good plane. And you can see that I'm coming right to the bottom of that nasolabial fold. You either want to stop before the fold or after, just to ensure we're not having any visibility after she is done with her treatment. So now I'm going in and doing one just a little bit lower. Her nasolabial fold was her concerned area today, so we are going in and doing two. These are both Arte 1 18 gauge. They're one of my favorites. She is, more on the thin side, but she still has really good tissue quality, so I was not concerned at all about going ahead and using those 18s. Now I'm just giving it a little bit of a tug, and it's going to feel pretty tight at this point. And then going in and just snipping off the ends. You can see there's a little bit of a pucker there, but as soon as you go through and pull over that point, those barbs are going to engage, and then just covering that with a Band-Aid. Now we're going in and doing our jawline. We're following the same exact pattern. So just going in with my lidocaine with epi. The epi just helps vasoconstrict that area and helps a little bit with bleeding. I don't have an assistant when I'm doing my treatments, so it's just nice to control the bleeding as much as possible. So when I'm treating, I am not, trying to wipe and all the things. So here again, I'm following that same exact process, going in with my cannula and just going straight down my vector. And again, going in with my lidocaine. I have a little bit of sodium bicarb in there. That's why my syringe is a little cloudy. Sodium bicarb just helps neutralize the lidocaine so it doesn't sting as much. Very similar to baking soda. It just neutralizes that acidity. But here I also have an 18 gauge, again, stopping before any area of animation so I don't get any visibility, and placing my thread. Same thing, going back, giving it a little tug. I don't want to pull it out. So just gentle tug, make sure it's in place and cut. And then we're going in and doing one more in this area as well. Like I said, her concerned area was really the nasolabial fold, and we're just kind of doing some maintenance on her jawline and neck. She's a patient that comes back once a year, and we do this treatment just to maintain. But same thing here, just going ahead and placing my thread. And a Band-Aid is going to go over this site as well. I just tell my patients to leave those Band-Aids on till at least the end of the day. Just especially with females with longer hair, I want to make sure that everything is, covered and we're not risking infection. Here I'm starting back over her SCM. The farther back I am here, kind of the longer pull that I'm getting, but the SCM is a pretty safe bet as far as safety goes, especially finding your depth in the neck. And it is going to look like I'm more superficial in the neck. She does have pretty tight skin here. And you will see I come back and forth just a little bit to try to go a little bit deeper. But like I said, she does have really tight tissue here, and it is quite difficult navigating through the neck. So I recommend getting really comfortable in the face before moving on to the neck. But as you can see, once you're in that correct plane, it's really easy to kind of glide. Now I'm just measuring where I want my threads to go. And again, it is going to look a tad more superficial than we are in the face, but we want to make sure we're in that smaz layer or like right above the smaz. So in the neck, it's just going to look thinner because the tissue is thinner. But I'm just going in and doing the same thing. And since I pre-tunneled, it is going to be a little bit easier to slide in there. But again, it's in the neck. So sometimes it's just hard to find a placement for your hands. You can kind of see that I change it up a little bit just to make sure that, I'm maintaining the same depth all the way through. And you can have your patient move and everything like that to make sure that you're, in a good position. So I'm coming as medial as possible there, just right medial chin in that little pocket of tissue, and then going ahead and placing my thread. And we're going to go through and do that same exact process here with my second thread. This one I'm coming a little bit closer to that jawline. She does not have much to lift. Like I said, we're really doing this for maintenance for her. She has a really nice, she's gotten really nice results, and she does other treatments aesthetically as well. And here, as you can see, I'm a little bit superficial. So I'm just I also have another provider in the room who's training, so they were kind of feeling there as well. But as you can see, I'm a little superficial on the end there, so I just kind of backed up a little bit, and I'm just doing a little bit of tweaking before going ahead and pulling out. And again, just a nice little pull. You can see that pucker there at the end. I want to cut as close as possible there, and then go ahead and pull over with my alcohol. And as you can see, this one just didn't snap in right away like the others did, but just give it a little pressure, and then it went ahead and engaged. And we're just going to cover that with a Band-Aid and let it heal. And that little blanching is from the lidocaine with epi, just causes a little bit of blanching there. But just smoothing that out, going bi-directional, making sure everything is nice and engaged. And then we will see her back in about 3 weeks for a follow-up.